Our Group 4 project discusses how gene therapy aids in treating sickle cell disease. So, what is sickle cell disease? It's basically an inherited blood disorder which is caused by a defect in hemoglobin. Hemoglobin is essentially a quaternary protein that allows for oxygen to bind to it, and if it weren't present, you wouldn't be able to retain oxygen in your blood. Oxygen is only able to bind onto the hemoglobin because the iron molecules present are in the 2 plus ferrous state, such that the oxygen atoms with the same negative charge can bind onto it. Hemoglobin contains 4 protein subunits. 2 are alpha globin and 2 are beta globin. And so SED is essentially caused by a single point mutation in the gene coding for the beta globin chain. So due to an isopropyl side chain of valine that interacts with the mutant hemoglobin, polymeric strands are formed, and these very strands are what cause the deformation of the red blood cell and are responsible for the lack of blood flow throughout the vessels. The hemoglobin causes the red blood cells to become rigid and sticky, which blocks the blood flow. This chronic lack of oxygen to your organs and your nerves can eventually lead to their failure. So overall, sickle cell disease can be found at birth, given a simple blood test. And so you essentially inherit the hemoglobin S gene and the hemoglobin A gene from each parent, which results in the inheriting of the sickle cell trait. And however, in order to actually get the disease, you need to get the sickle cell trait from both your parents. Lastly, sickle cells only live for about 10 to 12 days, but should be living for about 120 days, which is what causes this consistent shortage in red blood cells. And as a result, most people's life expectancy with this disease is only about 40 to 50 years old.
So, symptoms can be, of course, anemia, extreme pain, swelling of hands and feet, increased susceptibility to infections, vision issues, jaundice, stroke, and kidney, bone, and gallbladder diseases. It can be treated with pain medication like hydroxyurea, blood transfusions, vaccines, bone marrow transplants, and gene therapy.
Gene therapy is a strategy of medical treatment which involves the manipulation of genetic instructions in cells such that they will carry out their processes differently. It's very targeted and it's still during in the research process, and so lots of clinical trials regarding gene therapy are still being held. It has the potential to eliminate $2 to $4 trillion spent on pain relief medication and palliative care treatment costs, as opposed to direct treatment. Some of the characteristics of gene therapy are that, again, it's highly targeted, it uses the patient's own cells, and the eligibility for it is very selective. You need to be a healthy male of 18 plus years of age with no hepatitis. You cannot have had gene therapy previously, and you cannot have had a bone marrow transplant previously, and you will also need to be willing to undergo chemotherapy. As of now, gene therapy does not yet get rid of sickle cell trait, but after treatment, sickle cell disease can still be passed on to your children as well. And so, regarding gene therapy and sickle cell disease specifically, the form of treatment we use is called CRISPR, which stands for Clustered Regularly Interspaced Short Palindromic Repeats. And so, what CRISPR is just insertions and deletions of nucleotide bases in order to reactivate the production of fetal hemoglobin, which sickle cell disease patients need.
So, how does gene therapy fare against current options? Bone marrow or stem cell transplants are surgeries where a suitable donor, usually a sibling match, is found, and their healthy stem cells are infused into the body to replace ineffective bone marrow. The patient must go through chemotherapy, and the donor must go through stem collection. After surgery, immunosuppressive drugs may be needed for a short period of time, and engraftment takes around 15 to 30 days. There is a risk of cancer and organ damage, and the most terrifying is graft versus host disease, where the graft attacks the patient's cells. Blood transfusions can either be more blood or can either be where more blood is given or blood with sickle cells is replaced with healthy blood. The transfusions lessen anemia by increasing your oxygen capacity and lower your blood viscosity to reduce the risk of stroke, and must be given once or twice per month. There is a risk of alloimmunization, hemolytic reaction, and excess of iron, infection, and fever.
We know that sickle cells often block blood vessels due to their shape, but that is not the only contributing factor. Sickle cells also slow down due to their viscosity or their internal friction. This was discovered when samples of different types of blood were taken from the same person and allowed to flow through a thin tube. While the oxygenated sickle cells behaved relatively similarly to regular cells, albeit a bit slower, deoxygenated cells behaved much differently. While they initially flowed at an expected pace, the now rigid sickle cells began to rapidly lose speed. But why was this the case? Well, it was found that a dense mass of cells had begun to form behind the meniscus of the cylinder. This mass of cells consistently grew in length as the blood flowed. This led to the sample containing sickle cells to flow 3 or 4 times slower than a healthy blood sample. Based on this, experts gathered that the clump of sickle cells exerts a frictional force that is proportional to its length. Thanks to the quick and inexpensive nature of this experiment, it has made the diagnosis of sickle cell disease much easier and quicker in resource starved countries.
Okay, so gene therapy can be compared to computer science as well as actually implemented in the development of gene therapy products. And so I like to relegate the DNA in your body and compare it to a CPU of a computer or an operating system of a computer. Um, and so it tells everything what to do. And I also can compare uh, the four nucleotide bases, adenine, cytosine, guanine, and thymine, to zeros and ones in binary on a computer. And so what gene therapy is doing is changing those zeros and ones in order to carry out specific medical treatments. Overall, the speed, accessibility, and efficiency of computers is increasing while their costs are decreasing. And we also see concepts like Moore's law, which dictates that the number of transistors in computer chips will close to double every year, which means computing power is just exponentially growing. And we can use that rapid development in the treatment and diagnosis of disease. We've seen computer science in treatment processes like CRISPR, and machine learning can further allow researchers to develop gene therapy products. So I just wanted to explore how gene therapy uh, is developed using computer science differently as opposed to regular drugs. Regular drugs are, so the way they're generated, you have to generate thousands of molecules randomly and test them against cells, and you keep guessing and checking until you get a molecule that has your desired effect. Whereas in gene therapy, you only it's very targeted. You program the DNA into specific targeted areas, and you further narrow down the drug target to specific tissues or disease indicators. And so the regular drug development testing process is all about directed development. It's much faster and more specific. And with regular drug development, you only have a 1 in 19 chance of being approved at a real clinic, and that's only after 2 years and $10 million of investments. And that's because regular drugs have lots of side effects and they're not specific enough. And so computer science can fix this problem with gene therapy by targeting development and not relying on random chance to come up with new drugs and treatments.
Gene therapy alleviates treatment associated burdens by increasing quality of life and reducing costs for healthcare systems and individuals. It can increase life expectancy and normal range of activity, with the downside of reducing quality adjusted life years. However, most importantly, it still does not provide a cure as of yet, but is leading up to it. In the US alone, 70 to 100,000 people are diagnosed with sickle cell disease, and there still isn't any cure. If such a common disorder can be cured through gene therapy, it opens the door to curing more extreme diseases and disorders.
However, there are a few drawbacks to gene therapy as well, which includes extremely expensive treatment, which makes it inaccessible due to certain socioeconomic factors. And then there are questions of whether it's really worth it, considering that there are already treatments for sickle cell disease, regardless of whether they're temporary or not. And lastly, eligibility is incredibly exclusive, whereas gene therapy has only been tested on adults. So there could be an entire age group of people where there are unknown risks that have not been found yet.
Overall, gene therapy is still a powerful growing force of medical treatment that, through further development, can not only fully cure sickle cell disease, but also other chronic diseases that have plagued humanity for thousands of years. Thank you for listening, and here are our sources.